and speed. Action! Action when you're ready, Doctor.
Hi.
Hi there.
I am Dr. Hurwitz.
Hi, I'm Shauna.
Oh, it's nice to meet you, Shauna.
Nice to meet you.
Who's
This
this?
is my son Bennett.
Hey, Bennett. How's it going?
He's not feeling very good today.
No. Yeah. Tell me the story.
So he's had a fever of 102 for about 6 hours, and Motrin is not helping, so we thought we should bring him in.
Okay. Any other symptoms?
Just really tired. He just seems to be out of it.
Okay.
Just not feeling well.
And what was he doing earlier today?
He was just hanging out and went to school, and I picked him up, and he hasn't been doing anything since.
Okay. Anybody else sick at school?
Not that I know of.
All right. And prior to this, he was...
He was doing
His
pretty good. He does have a
normal, happy
history.
self.
Yeah, he does have a history of asthma.
Okay. Any trouble breathing today?
Have you had trouble breathing today?
Hey, Bennett. How you doing, buddy? Do you feel sick?
Yes.
Yeah. What's bothering you?
Pretty much everything.
So you feel achy all over?
Uh-huh.
Is there one spot that's worse than the others?
No.
Okay. How are your lungs doing? Is it hard to breathe?
No.
No? Okay. Has he been coughing?
Mm-hmm.
Okay. Is he producing anything with his cough? Is he coughing up phlegm or blood?
Doesn't seem to be, no.
Okay. Is he having any diarrhea or vomiting?
No.
Has there been any rash anywhere?
Not
No
that I know.
swelling anywhere?
No.
Okay. And tell me a little bit about his medical history. Does he
He's
have any
pretty-
medical problems?
Other than asthma, he's a pretty healthy kid.
Okay. And what medicines does he take for his asthma? Does he take albuterol?
Yes.
Yeah. Okay. But no other fancy medicines for asthma? Okay.
No.
Does he have any allergies to medicines?
No.
How about his immunizations? Has he had his shots?
Yeah.
Okay.
He's all up to date.
Good. At home, is it you and Dad?
Mm-hmm.
Okay. And does anybody smoke at home?
No.
You feel safe at home?
Yes.
All right. Well, buddy, I'm going to examine you, okay?
Okay.
Let's start by listening to your heart and lungs here. Heart sounds fast, but otherwise it sounds normal. Can you sit up? It's weak to sit up, huh? Alright. Why don't I roll you onto your side? Can you help me? Get on this side. Can you take some deep breaths, buddy?
Doing a good job.
Good. Two more deep breaths. He's not having any trouble breathing, and his lungs sound nice and clear, so
Okay.
that's good. Let me look at the skin in his back here. Does this hurt at all?
Yeah, a little.
Both sides?
Uh-huh.
How about up here?
Yeah.
Same, and down here?
Uh-huh.
So he's diffusely tender along the back.
Okay.
How about your arms? Does that hurt at all?
Not really.
Okay. His pulses up here are good. And his capillary refill is good. So he's pumping blood around real well. Can you help me take his shoes and socks off? Does this hurt when I move your legs around?
Yeah.
Yeah. Okay. Did both legs hurt?
Yeah.
Where are you with these shoes?
So the legs have no rashes. The feet look normal. And the pulses in the feet are normal as well, and the capillary refill down there is normal also. Okay, so there's pain sort of all over. Let me look in your ears and your throat, okay?
Okay.
Turn your head to this side. The face looks normal. That eardrum looks good. Let's look on this side. Well, that eardrum looks really red.
Uh-oh.
There's some fluid behind that eardrum. Does that ear hurt at all?
A little.
Okay. Now let's look in your throat. Alright, buddy, can you open up? Say ah. Stick your tongue out for me. Good. So I don't see anything abnormal in the mouth. Got some fillings. I'm gonna feel your neck, okay? Does that hurt?
Kinda.
I don't feel any lymphadenopathy here. I don't feel any abnormal lymph nodes. And his neck is nice and supple. Okay. Does your belly hurt?
A little.
Is one spot worse than the others? Or is it all the same? It hurts all over the same?
Yeah, it's all over the same.
Okay. I'm going to look at your tummy and your chest here, okay? No rashes. And I don't feel any abnormal organs in there.
Okay.
Let me listen. It's got normal bowel sounds. Okay. Well, he certainly looks ill.
Mhm.
What I want to do is try and bring his temperature down a little bit.
Okay.
You've already given him Tylenol?
Mm-hmm.
Okay. Or was it ibuprofen?
Ibuprofen.
Ibuprofen. Let's give him some Tylenol now and see what his temperature does. I would like to see him perk up a little bit,
Mm-hmm.
'cause he certainly looks miserable. But you show signs of maybe an ear infection
Okay.
on the left side here. His immunizations are up to date. He's not at risk for any of the real serious bugs that used to cause trouble
Right.
in kids this age. But he's certainly not normal today. So
Right.
let's hydrate him. He might need some IV fluids. He might need a trip to the emergency department.
Okay.
But let's see how he does with some Tylenol first, okay? Sound good, buddy?
Mm-hmm.
All right. I'll check on you in a little bit.
Okay. Thank you.
Hi, this is Dr. Hurwitz to speak with the ER physician. Hi, Dr. Smith. This is Dr. Hurwitz over at the clinic. Yeah, so I have Bennett Anderson here. He's a 6-year-old boy, previously healthy, up-to-date immunizations. He came in with a fever and lethargy today. He's truly lethargic. His temperature initially in the clinic after some ibuprofen at home was 37.8. After some Tylenol here in my clinic, it went up to 38.9, and he looks ill. So I noticed some swelling of the left eardrum and some redness. This may be related to an otitis media, but I'm concerned for sepsis. His blood pressure was 99/48 coming in. His heart rate started out at 120, crept up to 138. He's breathing 22. He's satting 98% on room air. But he looks truly ill. When I went back in to evaluate him about 15 minutes after my initial contact, he was basically moaning. His level of consciousness seems to have decreased, and I'm real worried about him. So I'm going to send him over by ambulance, and I'll let you take a look at him. All right, thank you. I'm grateful. Hi. So, I spoke with Dr. Smith in the emergency department. They're ready to talk with you once
Okay.
you get there, and they'll do another full exam and probably get some more labs. But his CBC looks okay. His white blood cell count is 10, which is normal for him. His hemoglobin, so his red blood cell counts are normal, and his platelets are 200, which is just where I want them to be. His sodium and potassium are normal. His kidney function is perfect.
Okay.
And we got his liver enzymes, those look normal too.
Okay.
His chest x-ray looks clear. I don't see any signs of pneumonia. I don't see signs of fluid on the lungs. And the outline of his heart, the structures in his chest all look normal to me. But I am worried about him because clearly he's not doing well today. And his temperature continues to increase. So why don't we get him over to the emergency department? We'll call an ambulance for you, and we'll get him over there within the next 20 minutes or so.
Okay.
All right, do you have any questions? All right, let me go make final arrangements.
All right. Thank you.
Thanks.